Healthier Together, sponsored by Regence Blue Cross Blue Shield of Oregon.
So what we have been seeing is a significant trend of individuals that are in crisis, that feel deeply alone and feel as though there's nobody who understands who they are.
More kids and teens are in a mental health crisis than ever before. While there are a number of factors at play, social media is in the spotlight right now. The Surgeon General just issued an advisory about the effects social media has on kids and teens' mental health.
Social media can be very polarizing in a lot of ways, depending on who you're talking to.
Dr. Caroline Finkel is the co-founder and chief clinical officer for Charlie Health, which offers personalized, intensive mental health care to teens and young adults.
What we're seeing a lot of has to do with this idea of self-harm and the idea of so much self-hatred. And I think that sort of leads into the social media aspect of things.
Research shows that children and adolescents who spend more than 3 hours a day on social media face double the risk of mental health problems, including depression and anxiety. And that's concerning because a recent survey shows that teenagers spend on average 3.5 hours a day on social media. But Dr. Finkel points out the impact of social media is different for everyone. For some, social media is a lifeline where they create meaningful relationships.
And then there are individuals who utilize social media like an addiction, who are awake until 2 a.m., who look at those different types of body types or ways to self-harm.
So how do you know if your child is struggling with the impacts of social media? Well, it starts with open conversations without judgment.
Asking questions. So staying curious and saying something like, I noticed that when you got off of your phone, you seem a little bit sad, or did something happen? I'm just curious what's going on. And start the discussion by asking questions and then listen. No, do not, whatever you do not lecture. Just listen and then ask questions. Listen, ask questions.
Dr. Finkel says to watch their mood before and after they're on social media. If you notice a significant shift, that's where you want to start the conversation. And keep an eye on how your child is functioning overall.
Being able to ask yourself, are they sleeping? Are they eating? Are their grades declining? Are they showing up to school? Are they showing up to work? Is this getting into the way of their daily routines?
Finally, and this is a big one, parents need to model healthy behavior with their own social media and phone use.
One of the things that I always am talking to parents about is if you want your kid to get off of their phone, you need to get off of your phone. Bottom line, end of discussion, full stop.
That can look like having a technology-free night with the family. Most importantly, being vulnerable and self-aware.
That looks like saying to your kid when you get home, if you both are sitting on the couch, you both are scrolling on your phones, looking at your kid and saying, I'm sick of looking at my phone. Do you want to go for a walk?
Now, all of this and the boundaries that you set for social media are all dependent on your individual child's needs. And if you think your child might benefit from more care, a good place to start is with your primary care physician. Find more resources at kgw.com/healthiertogether.